Press.
Okay. Join me in flag salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Lots of public. Do we have public comment? Just observers. Hi, everybody. Enjoy the evening. I would like to take just one moment to recognize Shireen. I believe that this is your last evening with us, your last board meeting. And you have been 4 years on the board, right? Mm-hmm. And we want to recognize you for your service. And I have to apologize, I didn't bring a big bouquet of flowers or anything because I was only reminded tonight that so we will.
That's okay.
We'll give you a medallion or a reward or something. So.
Oh, okay.
Okay. But thank you, seriously, thank you very much for your 4 years.
Yes.
It's been a privilege to
And
work
an
with you.
education.
Okay. And so moving on, we have the consent agenda. Did everybody have a chance to read the minutes?
Any changes?
Any changes to the minutes? Hearing none.
I move that we accept the consent agenda.
Okay.
Second.
We moved and seconded to approve the consent agenda as presented. All those in favor?
Aye.
Passes unanimously. Okay. Stepping right up with the April financial report.
You want me to do the financial report first or do the budget approval? Or you want, which does it better to you?
Doesn't matter.
Okay.
Let's go with the financial report and then we'll go with budget approval.
Okay. I do not have the PowerPoint that you're accustomed to seeing for the last several years, mainly because with Ed not being the CFO here and me not knowing how to change all of the documents within PowerPoint, I couldn't get it to work. A lot of times Joey prepares that, but he had other things he was working on. So we'll have to look at the, this is the financial report. Spreadsheets that you all have received in advance.
I'm more comfortable with the spreadsheet anyway.
Okay. Thank God for that. Okay. Those, as you can see, I can't quite get it all. Well, I can. Well, I guess I can. So it won't quite fit on the page. You would think I could slide it over.
Yeah, down at the bottom. Up there you go.
And then you can't see the titles. So, sorry for that.
Well, you can hide a few columns.
I was trying to. Here, that makes it a little bit better.
Okay.
Yes.
Okay, so, pardon me?
Now I can't see anything.
Well, if we wanted to make it bigger, Gerald.
Oh, there, now. Well, you could take the first 2 months and decide those columns.
Well, I was trying to do that, but it doesn't seem to want to do that in this presentation, so I will not waste people's time. April was not a good month for us. We had good revenue. It was within the line of the other months, $4,125,000. Our revenue deductions continue to be higher than they have in the past. They're running about 27%. It's about 25% for our contractual adjustments, and we're running a higher percent in our uncollected or write-offs. So I'm not sure that we have been writing off as much as we appropriately should have been. We're talking with Blanca about that. We have work to do on that. So, but our net revenue for the month was $2,800,000, which is in line with the last couple of months. We had, of course, good months in January and February. April was lower than March. Our expenses continue to be higher than we want them to be. We are down a little in wages, but we are continuing to be using a great deal of contract labor. As you recall, when we started the fiscal year, we were planning on removing the need for contract labor, especially on acute. We tried that, and we immediately had people have health issues. So we needed to bring back in contract labor. It is an extraordinarily expensive situation. Put it in perspective, it's now 37% of our total labor is contract labor. It's huge. And we have to make some changes about that. We are not unique in this problem, but our problems are that we have to make adjustments to that. When we look through all our other expenses, they were not out of line, and we ended up having a loss of $836,000 for the month. So a total of $2,300,000 loss. That's a huge number, and we have to make changes. We are struggling with contract labor. We are struggling with not collecting enough. Some of the literature says that insurance companies are paying 30% slower and less than they have in prior years. And this is not just us, this is across the board. There are systemic problems that we are facing. They are consistent with others, but we have to make adjustments. And so that's what we've got to do right away. There isn't anything good I can say about what we are experiencing. I think you've all seen it. John, you and I have talked about it a fair amount. Don, you and I have talked about it. Gerald, I know you've looked at the financials as have you, Shreen. Are there any details you would like me to point out?
Well, I just want to make a comment in that, COVID's been hard on the Lake Health District. Contract labor has taken a toll, and all the battling with the insurance company has also. But COVID is over. We have to reset our business model. And, this isn't sustainable. We're going to have to make some changes.
It's not. Now, it doesn't help that we switched computer systems to Cerner in the middle of COVID. And while Cerner is a good program, it is difficult to adjust. And the expectation was that we were going to have trouble with our business side of the collection, making sure the bills are right, all the processes. And it was recommended and predicted that it would be at least 2 years of getting through that. Well, this is during that time. And it is still very difficult. As you know, I think it was in February, you agreed to approve engaging an expansion of Cerner's work with the ORCA. We did that. We also expanded our relationship with a company called Experian. Experian will be up and running in November. It's that long for them to get their software set up and working. What that will do, amongst many things, is it will ensure that when patients are admitted, we are going from being between 50%, and it's hard to say exactly how much, but roughly 50% accuracy to 95% accuracy, having all of the patient's information. That'll be a big step toward us being able to bill correctly. ORCA, the purpose of ORCA is we're essentially paying Cerner extra money to have them focus on fixing the problems that they haven't fixed. We have brought Cerner representatives here, senior representatives, saying this is ridiculous. We've got 50 plus questions for being fixed. And they couldn't even agree that our report that is in their system is the correct report. They're now getting a little closer, but we're a long way from being where we need to be. Now we can blame it on software, we can blame it on a lot of things, but you're right, John, we have to modify how we're delivering the service. We have to refocus on what is our primary business and make adjustments. So what I would like to be able to do is ask that you hold a special meeting, a work session, to talk about options of what we can do and what we should do and what we need to do before we bring that into a public discussion. And I'd like to suggest that you consider either the 14th, 15th, or the 19th or 20th. If you'd look at your calendars and see what days work. You don't have to do it right now, but certainly by end of day tomorrow. And we'll ask if Jane and Jen are available to sit in. You're not on the board, but your input will certainly be valued. And Shereen, I know this was meant to be your last meeting, but you have lots of insight and your input would be most helpful. If you can, that would be great.
14th to 15th works for me.
Either one.
Okay.
Either one. Prefer the 14th.
I can make 14.
Okay, 14th.
I would just say that in additional news, before you set that date,
Okay, I was going to ask Jen.
you might want to be advised that we have hired a chief financial officer. His name is Prahan, and I'll get good at this, Kumarasamy. Prahan Kumarasamy. And he starts on Monday. So he understands, and in the interview process, he understands the importance of being involved in our organization. And on the 14th, he may have had 2 days or 3 days. Might want to think about Monday or Tuesday, the 19th or 20th. But that is really up to you. A lot of it's going to be all new for him anyway.
And he is a CPA.
He is a CPA.
Right.
He's had many years of experience in healthcare, has worked in critical access hospitals some time ago, but has had other experiences, especially in revenue cycle and other similar industry businesses.
He's going to have to hit the ground running.
He is aware of that, and we will help make that happen.
I'm out of town the 19th, otherwise I can make any other day work, so.
Okay, the 14th would be good?
Mhm.
Okay. So we'll look at it on the 14th.
You could make the 15th, but you do one more day.
15th is not good for me.
Okay.
I already promised somebody that I would do some sort of lunch program on the 15th.
So it's probable that it'll have to be after the medical staff meeting, which is from 12:30 to 2.
Okay, but it's no time.
I will. But if that can work, we'll make adjustments.
14th.
Are there other information that you would like to have me show on the board, or to the board from the financial information you
No,
received?
what we're going to be looking for are options, what you're...
We have
what you're
lots of
gonna-
information that we'll be able to provide you.
in order to be able to select the
Right.
course of action.
Yes.
Okay. So the 14th.
And I'll make sure that you, it's also my hope and prayer that Lauren will be able to start on Monday, even if it is for part-time. It's been a little tricky not having anyone providing assistance. She's been out for about a month
Where's she at?
on medical.
Oh.
So, anything else we can talk about on this? If not, I'd like to go to the next
Next item is
item of business.
the resolution 2023-1 for the budget approval. The budget board earlier presented and approved the entire budget. Of course, you were all here. So we're looking for an approval of resolution 2023-1 for the budget approval.
So moved. Second.
Been moved and seconded to approve resolution 2023-1 for the budget. All those in favor?
Aye.
Passes unanimously. Okay. Second is a resolution to allow the hospital, Charlie.
Before we jump into that, we also, so that you understand, by doing that resolution, you are authorizing us to notify the county to levy the taxes.
Right.
And so that's part of that resolution. Just want to make sure that you're clear of that. Okay? We do have both Roger Ford and Chris Peters from the Washington Federal on our Zoom call. And one of the things that we have talked about with both the board and when we talked about our budget planning as well as with Washington Federal is the need for additional borrowing. We have been providing a great deal of information to Washington Federal. We originally thought that we would not need the money until September. We need to borrow that money now.
And it's in the budget.
It is in the budget, not the time. So what I would ask is that while we have not drawn up any documents on any amount of what the loan particulars are, what we probably need to do is either authorize me to work with the bank to go through and set up that vehicle, and then call for a board meeting to approve that. Is that what you would like to do?
That's what I was
Yes.
intending, yes.
Yes.
Okay, so, and what I would like is that you authorize me to engage Washington Federal in that discussion, and I will present you all the particulars of the vehicle as soon as I have.
Okay.
Does that need to be a resolution or a vote?
I think a vote would be helpful, that,
Just to authorize you to
correct.
go forward with
And
the
then
loan.
once we then have a document, or a vehicle it's called, I would then present that to you as quickly as I have.
Well, I so move that we authorize our CEO Charlie to engage discussions with WAFED to get additional working capital through a new loan.
Okay. Been moved to authorize. Shereen?
I'll second.
Oh, okay. Shereen, it's been moved and seconded to authorize go forward with requesting financing from WAFED. Allow Charlie to go forward with that. All those in favor?
Aye.
Passes unanimously. Okay. Next item. You're just in the hot seat today, Charlie. Goose Lake.
One of the days, next meeting, we will certainly have a chief financial officer that will be able to help and provide more specific information. Okay. Lakeview Gardens. Gerald, is this large enough?
Yes.
Okay, good. We had a little better month in the month of April. For revenue, we were up 228,580, and that's because we have opened up the second house, and we have more patients. Unfortunately, it continues that we are needing more contract labor than we want. And that being the largest component of our cost, we've made some adjustments on how we're delivering service, but in the month of April, we still had a loss of $153,000, bringing us year-to-date to $1.3 million in loss. I am sorry to say that when I said to you that I was engaging with our legislature to obtain cost-based reimbursement for long-term care, we were fairly confident that that would be able to be a possibility. Unfortunately, our Oregon legislature has been at a standstill for a long time, and they are not able to even get that onto a bill. I'm not even sure it's not clear if we will, what will happen between now and June 25th. Pardon me?
I'm not sure we're going to see any bills get through.
Well, there is some possibility. There are some bills that are progressing through committees, and there is some discussion that they might meet on the last day to approve a budget. If they don't, then they have to come back for a special session. In the meantime, our ability to get cost-based reimbursement is not going anywhere with the legislation.
So
So
we have to go forward with.
we have to do what we have to do. I'm just telling you, that's unfortunately what I was very vocal for. So we have to look at issues related to how we're going to deal with leaky gardens. On a positive note, the only thing positive we have today is Lake Health Medical Supply. We had a banner month in the month of April, $51,000 in revenue, and a positive bottom line of $14,500. So a net total of $102,000 for the year. That continues to provide good service and is a profitable business.
Good.
And they work very hard. Everybody works hard at what they're doing.
Yeah.
And there's no question about it. Any questions about Lakeview Gardens?
Okay. Hearing none. Scott, Dr. Graham's not here.
No.
Anything on the?
Not the only thing that I need to advise you is that unfortunately we received a resignation from our dermatologist. So all the visiting dermatologists and our medical staff had resigned.
Where were they coming from?
They were coming from Benton.
Do you know why?
The hardest part about getting specialists to come to a remote community like this is that a lot of times this is an expense that's not really necessary for them. It helps them build up their business, and once they get enough business and patients are willing to drive for that important service, it isn't financially viable. A good example of how difficult it is for us to find orthopedic surgeons, we have the capability of doing knee replacements in our operating room. The best we could ever do is 3 surgeries in a day. At the surgery centers they're accustomed to, they can easily do 6. So economically, it makes sense for patients to drive to Bend or to Medford or to wherever for the physicians to be most efficient. We try very hard to encourage people to be here, and sometimes they are motivated to ease the burden of community members. Other times, the demand for their services are so great, it's more important for them to continue delivering it where they can be very efficient and see more patients. It's a difficult challenge that we face all the time.
Any other
No.
questions?
So, sorry.
Tori, nursing report, how are you today?
I'm good, thank you. Nursing report, our census has been up lately, so that's great. Today we have 15 patients, 7 of them are swing beds. We've been staying around that number for swing beds, which suits us well. So that's good. Staffing wise, we've gotten some permanent CNA applications, so that's good news. Terry's starting a CNA class on Monday. It's got 7 students in it, so that's good. 2 of our first year RN students just finished their first year and will move on to their second year in the fall. And we have potentially 3 RNs for our first year cohort in the fall as well. 2 of those are current employees here, so crossing our fingers that that comes through, and maybe a few others.
Tori, how many RNs are we short now if the world was ideal?
About 12.
Short? Wow.
Wow.
And with that, unless you have any questions for me.
Any other questions? Nope, thank you.
You're welcome.
Appreciate it. Okay, department managers reports. Looks like we've got several people here. Tyson, you have a report.
Emron didn't get a sign up there.
Come on. Next time.
Things are good in EMS. We're a little understaffed at the moment, but we're making do. I'm happy to say that I went to the North Lake EMS board meeting last night, and they're not quite as far in dire straits as they have portrayed over the past few months. So we don't have to worry about any sort of additional services being added for up there
So
anytime
they're
soon.
going to continue to operate? They can.
At least until the end of next year.
Okay, that's good news.
Yeah, that's very good news. Other than that, things are great. I got a couple education requests coming up in the HR report. And I think at this point, for this month, we're almost to half of what we've made as far as billable revenue over the past 3 or 4 months. So it's been a pretty busy month with transfers and such already.
I noticed in our April report, the one we were just looking at, the EMS revenue was way half of what it was previous months. Do you know why?
I think that we figured that out. There was a little changeover in billing. It actually was more than what was portrayed. And there's a 3-day lag with Cerner from when we input charges to when they actually show.
Does that mean in May we'll have a good month?
May should be about, I want to say it's right around 90,000.
Because we're 35,000.
Yeah, there
April.
was some stuff that got missed in both months actually that we've since fixed. So
Good.
April should have been about 100 and some thousand as well.
Well, okay.
One of the challenges we face constantly is trying to find those issues within Cerner where we think it's being done, and then we find that it's not, and then we have to go back and adjust it. It just takes a vast amount of time. But we're getting the systems bit by bit, getting it better. Just, it's extraordinarily frustrating. And the staff work really hard to try and get it right. So,
I track each one manually, so I know what we should have billed out. Whether or not that gets into Cerner on time is a different story, but we're getting it to where we're inputting charges on a more regular basis, other than just having somebody that was doing it when they had a little bit of downtime.
Right. Getting the charges input is one thing, and getting them approved by the insurance companies is another.
Yes, which along with that, I have submitted paperwork to OHA. They have 2 different programs for ground emergency transport. One is part of the CCO program that guarantees us a rate for that. And the other one is a fee-for-service program, and both of those are under review right now.
Okay.
Will that increase revenue for you?
It should increase some revenue as well as what we collect.
Yeah.
Right. Lisa?
Oh, you know, I never have anything to say. But, so in short, over the last 5 or 6 months, I've been giving you numbers on patients. So I'll just kind of condense that. We have been going through all of our providers and adjusting their panels to make sure they're a true reflection of the number of patients that they're seeing. So with that being worked on, we are at 491 patients who need a primary care provider, which is still a huge number, but I don't see it going down until we get some help.
Right.
And we're still working on that, so you're very well aware of that. We are working on what they call PCPCH, so it's a program from the state of Oregon that requires us to provide good care, basically, in a nutshell. So we have implemented surveys for both patients and employees. We are getting a vast number of surveys back, and they're good results. We have to meet 3% of the number of patients in a provider's panel, and we've overdone that in the quarter. So every quarter, we will change the survey to see what the community wants from us and how we can implement it. So it's about satisfaction and about providing the service. Our clinic teams are working very hard to provide quality services to our community. And I just wanted to mention that we've had an increase in the number of patients being seen in the surgical side, in OB, surge, and wound care. So they are very busy. And that's all I have, unless you have questions of me.
Questions?
Thank you.
No, thank you
You're
very
welcome.
much, yes. I attended the surgery side as a patient earlier, so.
How was your
thank you.
service?
It was a good trip.
Good, good.
The anesthetic was very good. Anyway. Amra, Shirley, I almost,
Oh, I'm down here.
oh, you are, okay.
I'm later.
You're on the agenda later, okay,
Yeah.
we'll wait. Amra,
Okay, so although our margins were still quite positive, not quite what we have grown accustomed to, that's all tied to staffing. With losing both my permanent OTs and my permanent ST, that changed our department quite a bit.
What's an SD?
Speech therapy and occupational therapy. Next week, we will get a speech therapist back who's a temp, but we also have a perm lined up the 1st of August. We're happy to have Julia back on our team. She was away for a little while and decided she wanted to come back with us.
good.
That's going to be good news for us overall. She's quite productive and good at her job. We're happy about that. Still looking for permanent occupational therapy. I've done quite a few interviews and nothing has really stuck so far, but that's the biggest change in our department is staffing will change. We'll resume providing weekend services in the hospital the end of next week. So not this weekend, but next weekend, we will resume providing those cares in the care in the hospital for physical therapy and occupational therapy. That was good for us too when we were able to do that. So it'll be good to get back to it. Any questions for me at all?
Thank you.
Yeah.
Yeah.
Cardiopulmonary services. We, so far for the month of May, have had a pretty good uptick in outpatient services with pulmonary function testing, stress testing. You know, we have quite a few things on the books for, I meant for June. May was pretty slow. The good news is in cardiac and pulmonary rehab, I believe we have more patients currently either in active classes or have their intake scheduled more than we've ever had before. So I'm encouraged that we're getting the referrals from our physicians and other providers to get patients in there for life-changing education and exercise management, and it's very helpful, especially for those with diabetes and other comorbidities, to help with medication management and things like that. So it really truly is a kind of an all-inclusive program. Our numbers in the sleep lab have been down. I think the biggest part of that is we do have patients that have been in the wings, but a lot of them are from MODOC, and every week I get a call from the referral management gal down at the MODOC clinic, and you know, we struggle with the acceptable reimbursement from Partnership
Yeah,
Health.
That's a tough one.
It's really hard, and you know, the last email that I got from her, you know, the patients are driving 3 to 6 hours for their sleep tests, and they're like, can you please do something? I'm like, my hands are tied, I don't know what to do with that. And so, but we're doing the marketing and doing all that we can to, you know, to make sure that all of our billing is accurate and everything meets medical necessity, and working with our referral management team. They've been great. Everybody's been working well together with that. So I think June's going to be much better than April and May.
Hopefully, yes. Okay, any questions?
Can you approach some of the billing by hardship cases, you know, when people have to travel with, you know, sometimes insurance companies will take that into consideration.
Yeah, it's not the commercial insurance or Medicare. It's specifically Partnership Health. That is a challenge.
What is Partnership Health? Is that a carrier in California?
I think it's like the EOCCO of California, I think is what it's like.
It's a Medicaid.
So the bottom, if I can jump in,
Yeah,
Kim,
please.
unfortunately, the hard part for us, being a border hospital, is the Medicaid patients or Medi-Cal patients of California come here for care, and Medi-Cal essentially doesn't pay us. Or if they do, they pay us it's just 10 cents on the dollar, maybe 20 cents. And that's if they will pay a little bit. We have tried everything we can to get Partnership to pay a reasonable amount, and that while they promise they will, it would be better for us if we put up a sign that said, no California patients accepted, because we just can't get paid. And we can't do that in our emergency room, and I would never, ever say that. But we just aren't getting paid. And California is very happy to have their residents come out of state to get care, because that means that another state has to pay for the care that California does not pay. And it's a horrible thing, but that's the situation we face. And of course, for the state of Oregon, if a Medicaid recipient receives care here and we don't get a full amount through our cost report process, the state covers our costs for virtually all of our costs, so that we don't lose any money on that. But that's not the case for the state of California.
Yeah, my report from Joey is, it's 20%. And on some procedures, that doesn't cover the cost of the employee's time that it takes to do that procedure. So I'm not sure that it's exact that across the board, but, we certainly want to see all the patients that we can, in our service area, but it makes it difficult when you lose money on a procedure.
Well, we can't lose money anymore on
Exactly.
patients that, certainly not Oregon patients.
I know I'm
We're
speaking
here
out
to
of
serve.
turn, but have you guys ever tried to get people from Klamath Falls to come to our sleep lab? Because I know when I was doing referrals, there was like a 4 or 5 month wait in Klamath Falls for a sleep lab.
And mentioning that, Dr. Panosium in Klamath Falls, it does refer patients to us because he does have patients that he just simply can't fit in. So in part of our marketing efforts, we are working with the VA, we're working with Dr. Panosium, working with some of the outside sleep centers like in Reading, things like that, for patients who have the coverage that we can take. We can certainly get them in right away. So we are expanding our reach, so to speak, so that we can get those patients served.
We do provide information to the public to know that they can come here from Klamath Falls. Unfortunately, a lot of people in Klamath Falls thinks it's worth the wait rather than the drive.
But we still get to try.
We try. We try to advise them and give them options. But that's not always how it works.
Okay. Anything else? Do you have anything you want to put in?
No, I'm just an observer, but thank you.
Just here to look on, okay. Any other? Doctor? Oh, okay. We'll move on then. The next item on the agenda is Shirley. I almost made you jump again.
That's okay. So good evening. Just from an HR perspective, we have no grievances for ONA or Teamsters. You're welcome. So yeah, we just want to make sure our goal is always no grievances, so no grievances. We are working, just to let you guys know from like a benefit standpoint, we're working on FMLA outsourcing through our broker relationship. So we have family medical leave. So we're making sure that we're in compliance on that. So that's a project that we're working on. Obviously heavy recruiting. We have, this week alone, we had the 7 NA students, and we are working on summer lunch, as you know, so we're launching that project, so that's coming up. We have DAISY Awards that we're working on with nursing, so that's a new program that we haven't had here.
What is that?
So DAISY, do you want to explain the DAISY Awards, just because it's more of a nursing thing?
Sure. DAISY Awards are, it's a nomination that either families or patients can do to nominate a nurse for the good care they've received. And then I believe coworkers can nominate each other, right? So it is for just nursing, but it is, it's a way to allow the public to nominate a nurse for recognition.
So nice program, feel good, definitely for morale. And let me see what else. I think that's it. And then I just have some, I know you guys wanted statistics, so I've been tracking hires and separations for Charlie. So just to date, we have 47 people we've hired from January.
Year to date, or since January?
Since January, so January to today. We've had 47 and then 39 separations. So we have it broken out, but just to kind of let you know, like the average, real quick, January, we hired 12 people, 5 people left, February 8 and 8. Funny enough, March was 7 and 7. April, we hired 9, 8 left. May, 10 people, 11 separated. And then so far, this week we had 1 and we have 4 more. Every other Tuesday we do onboarding, so we're pretty busy.
Yeah. So the turnover is pretty normal right now. correct?
Yeah, it's pretty normal, but we're staffing pretty well. I mean, despite like how hard
Except we're
it's
short
difficult.
12 RNs.
Well, you know what, if I could go be a nurse, I'd be 1 for them, because at the end of the day, it's very hard. But we are absolutely, we're everywhere. Like Indeed, we're pushed out everywhere and stuff. We have the Nurse Corps program. There's just, it's a lot. It's just interesting right now, because we're not getting a lot of interest, but it's not for lack of trying. We've been at 3 different job fairs. We've been at OIT, KCC, and Chamber, so.
I heard the Ben nurses are getting ready to possibly strike, so.
Yes.
Although it was just announced today that they had reached terms and that the ONA has rescinded their letter to go on strike.
At St. Charles.
As of this afternoon, out of St. Charles, yes.
Okay, so we have 2 education requests, and then we have an update to the scholarship for the NA students loan agreement, a little bit of a revision. Do they have that in front of them, or no?
The revision to
Yes.
And what is the stuff in yellow? This is the changes?
Those are the changes. So essentially, what it was originally created was for basically full-time, 20, 80 hours, but we realized that there are students that are going to be in school still, so part-time we added. So the yellow is essentially speaking to the part-time students, just because if they were working part-time.
What PRN stands for part-time?
It's basically
As needed.
as needed, but I know it's specific. PRN, it's a little different for me. But that's on-call, essentially. So we just wanted to change that to add for the students that work part-time, because it essentially was just the 20, 80 hours. So that is what is highlighted in yellow for you.
So we have the education request in EMS.
Yes, we do.
Did you want to agree to the, it's still a requirement of 280 hours of work. It just doesn't have to be fulfilled within 1 year.
I think it's fair.
What we didn't address in this is if they work, say, 180 hours and then leave, or 140 hours, 1,040 hours. So half of the amount of time, would they still be obligated for the full amount of the loan? So one of the questions would be, would we give them grace for the time that they've already spent? Or would we say it's all or none?
I think you should prorate it on the months they work. I mean, in other words, on the Prov Scholar, how it used to work is you got 1/30, it was a 36 month, and you got 1/36 of that amount forgiven each month.
Well, if that's the case, then we would want to add that in once they finish the class.
Yeah,
In the
that's exactly
past-
the right thing to do.
Okay, in
So
the
they-
past, it had been, they were obligated to work the full time, or they had to pay it back.
I think if you prorate it over the months, and so they would get credit for some of the months if they worked, but if they left early, they still would have to.
Makes sense.
Yeah.
Yeah.
Are you, so you're in agreement with that modification?
Correct.
Yes.
Okay, if that's the case, then we would like to adopt this policy.
Does this need to be a motion or?
Yes.
If you would.
Is the motion with that change then?
With you, if the motion is to modify this form to have it prorated based on the amount of time, because
Number of months worked.
we don't want to necessarily use months.
This is in hours, we could do it in hours.
Yeah, keep everything the same.
Okay, we can do that.
So
Okay.
do
I would so move that we adopt the Lake Health District Nursing Assistant Scholarship Loan Agreement with the changes set forth.
And I amended to include the proration of hours worked.
So as, okay,
Yeah.
thank you.
Adoption of the loan agreement with
Yeah.
hours worked.
With a prorated clause,
Yeah.
similar to what we've done the others.
Okay. All those in favor? Or
Aye.
did we have a second?
Awesome.
Second, okay. All those in favor?
Aye.
Yes, okay.
Thank you.
And then we have two education requests, both from EMS departments. One is for Rachel.
Yeah, so Rachel Bonine has approached me about taking an advanced EMT class. She put forth the legwork, reached out to the school. It's a place called Idaho Medical Academy. They have campuses in both Portland and Boise. For a self-paced online advanced EMT class. And at the end of the didactic portion, she goes to Boise for a week in order to do the skills week, and after that, she'd be able to take her EMT test, or for her advanced level test. I kind of want to use her as a pilot, because we've had so much trouble with KCC and their EMT program over the past couple of years. Christmas Valley's having the same struggle currently with theirs. In order to see if we want to pursue more relationships with the school. Because we don't really get enough interest for EMTs to take a class for us to be able to justify holding a class. I mean, typically, colleges want 8 to 12 students, and we're getting 2. So they also offer an online self-paced EMT basic level course. And I think this would be super beneficial for us in the future when we get those 1 or 2 guys that say, hey, we want to do it. It does come with a 2-year agreement to work for us after the end of the course. And if that, it'd be the same or similar to all the other contracts. If they don't complete that 2 years, they have to pay back the loan.
And it would be prorated.
I don't know if we talked about the prorated part, but
I don't think it's prorated.
I don't think it's prorated. I think the cost is around $1,500 or $1,600. I'm sure they.
$1,640.
$1,640.
Is there anybody else participating in, or any other supporting entities?
As far as clinical time, she would do that here, so she wouldn't have to go to Boise to do her hospital rotations or her ride time on the ambulance. She'd be able to complete that here. So we would have to figure out a way, or her fire chief up in Silver Lakes also offered to help out with the week that she has to go to Boise and kind of pay for some lodging and meals and stuff like that for that week.
That's what I meant.
Because she does volunteer up in Silver Lake, so I think it'd be beneficial for both ends of the county.
But have you turned in a request with the estimated dollar amounts?
Yep,
et cetera?
Shirley's got it.
I believe I sent that to you in the packet.
I didn't see it.
So you also got the wrong agenda, so whatever I sent you didn't work exactly perfectly.
I sent it to him.
You need more.
But you said the amount is somewhere in the range, there's 2 people interested in the amount, somewhere at 1,600 plus.
1640, just for Rachel's, the other one's for a paramedic course.
Yeah, there's 2 requests. One's for the EMT advanced, and then this one's for a paramedic, so 2
And we
different
haven't
ones.
hashed out how much it's gonna cost her for the week in Boise just yet.
I think as long as she meets the criteria, that it's important that we keep educating people here in Lake County.
Yeah, and it'll add another advanced level provider to our service as well.
And that's what we have the education program for. So as long
And
as
we
she
have-
meets the criteria.
And we have the funding available to do it, right, Charlie?
We do.
So
Remember, we have 2 different programs. One is the OCF program that is, we probably won't have much in the way of any monies available till next year, but this year we do have roughly $100,000 in the education fund.
Right.
It is up to, it is at board discretion.
And then the second one is for Brittany Stevens, and she's requesting for a paramedic.
Brittany actually didn't tell me that she'd submitted that
Sure
paperwork.
did.
Oh.
It's right here.
So she's already entered into a paramedic course online. And I don't remember which school it's through, but it's a
the
similar
National
situation.
Medical Education and Training Center.
Yeah, it's
They're
a
out of
similar
Boston.
situation, the one out of Boston. where she would do all of her didactic coursework over the course of the next year, I believe. And then go to Boston, I believe it's for 2 weeks, to complete her clinical hours and skills evaluations and all of that to become a paramedic. And I don't have that dollar amount.
10,000
10,000?
for the first semester.
How many semesters are there?
There are 4.
40,000.
I think that's a little on the high side. I
Yeah.
believe that program's only 10,000 in whole.
Okay. Because when I looked it up, I didn't see anything else.
Yeah, I think that the program in its entirety is only $10,000.
For all $2,500 a year.
If you'd like, we can come back
Yeah.
with more accurate information.
It'd be helpful. I'm
Yeah.
a little uncomfortable with
Yeah.
that dollar amount and the amount of information we have.
Yep.
And I don't know if we had an email glitch or what, but I didn't see this. so-
This one just arrived.
But I think there should be a form that goes what the costs are, and travel costs, and tuition costs, et cetera, so we look at, know what the amount is being requested.
Okay.
So what did you want to do on the first application?
First application,
I'm moving forward with that, because we have a dollar amount, and we know what that is. So I move we accept the first application.
Second.
Have been moved and seconded to accept the first application for the education request from the EMS department. All those in favor?
Aye.
Passes unanimously.
And the second one, we'll get more
request,
info.
we'll look for additional information. And, you know, we don't have to approve the full amount. We can approve lower amounts if necessary, so.
And on this paperwork, basically, if they don't finish the program or anything like that, they have 45 days to pay us back in full for what they
Yeah.
didn't. So that language is different than the other one.
Oh, it is?
For the NA scholarship, it's different. So this one's different.
So we do need that additional information.
Okay.
Hey guys, it's Mikey from CA.
And we already did the scholarship loan revision, so next item on the agenda is the CEO report.
So we have lots of things that are constantly going on. Thought I'd give you an update on the burn grant and the process for acquiring the Bedford building. We finally just today received the documentation on what the state would require if we go ahead and make that acquisition. What the state requires is that we would commit to providing that service, which is specifically dealing with resource hub to make screening, health assessment, treatment, recovery service for addiction available to all who need and want provided services, and provide recovery service, coordination, supported education, all the components of that burn grant. You have to commit to doing that for the next 20 years. In order to sign this, we have to have the county commissioners agree to this, because remember, we are operating the mental health service on contract to the county.
This is a county program, and the county is financing it, so, okay.
So I received that information today, still not even approved by the Department of Justice, but we hope to have that resolved. And we should be able to move forward. There have been a number of suggestions that we use Oregon Energy Trust and other granting entities to help in the refurbishing of the building, so hopefully we'll be able to stretch those grant dollars for that purpose. And it looks fairly promising. I received a notice in the last week that Meridian, which is the Medicare or CMS entity for the northwest part of the country, is doing an audit on our 2020 cost report. So we are making arrangements with Whitman, since they prepared the cost report, to answer questions that Meridian has. This is the first time that I've seen that Meridian is auditing our cost report. And it's I don't know what the thresholds, but that's how they're doing things. I talked a little bit before about how we're working with Cerner. It's a struggle, but we will continue to push hard on that. Sometimes we're getting what looks like good support from them, and other times it's still very frustrating. I'm happy to say that as of Monday, the EOCCO, which is the Eastern Oregon Coordinated Care Organization, their board of directors voted to approve 2 grants for Lake County. One is to the Lake County Food Share for $30,335. I don't know when we'll get that money. That'll go toward supporting that organization as it tries to get better at the services it's delivered. And the second request that we had put into the CCO is to help in the transition of the senior center into a community arts center. That grant is $49,017. The senior center will be working on becoming more available to not just seniors, but to others. As you know, we received a grant that helped modify the basement of the senior center to become more of a arts and multimedia center. So this money will help go toward continuing in that process of converting to not being just a senior center, but to being a community arts center. It's pretty exciting.
Yeah.
We are working actively with another program, another grant program that the state has for behavioral health. It's a workforce support program, and it's about $120,000 that we're right now in the process. They're anxious to give us the money to help us support our behavioral health employees and there's the staff to provide more service and to incentivize them to want to move to our great Lake County. Other than that, it's been kind of slow. Any questions that I can answer? I would say that Shireen has made some marvelous delicacies and that while the board is almost over, board meeting, I'm sure she doesn't want to take them all home. Thank you for that, Shireen. We appreciate it.
So she brought her own gifts.
I
Oh, my goodness. I'll have a long time living this one down. Anyway, we'll go into executive session under ORS 192-660, Bracket 2, Bracket A, personnel, Bracket C, medical staff, and Bracket E, real estate. And thank you all for coming and spending a nice evening with us.